Not into long podcasts? Don't worry, we've got bite-sized clips just for you. This is CWN Clips. Please don't forget to subscribe.
I want to move to pediatric brain surgery as well. So while you handle pediatric
Yes.
brain surgery as well. So I mean definitely there is an associated challenge when it comes to pediatric with the nature of the children and the emotions which goes through, and probably sometimes they may not be able to even talk about what's happening, right? So it's more of again idiopathic from a reason, also from the patient themselves are not aware because it's their juvenile, and probably children is definitely not aware of what's happening. So and how do you what are the unique challenges you've seen technically as well as emotionally handling pediatric surgeries?
So it's always like that when it happens to your kid. Obviously, you are more worried, right? So in a society like ours, in which it's so strong culturally, everybody is so strongly bound in a family setup. The emotional component is obviously huge when it happens to the children. So there are a very particular set of conditions which we often see in children, especially in tumors. Usually they are in the back of the brain, which is called as the cerebellum. Then they have something called hydrocephalus, which is an increased accumulation of fluid in the brain. Some of them have abnormal spine problems, which is called spinal deformities or spinal dystrophism. So these are all the common conditions that we see, and we treat them on a routine basis. So what are the technical challenges? Obviously, there is a challenge of anesthesia, right? So if the child is very young, if you ask me how old child have you operated, I've even operated on a 1-month-old child, 2-month-old child. So there is a challenge in terms of anesthesia. That is one thing. The second and the most important challenge is in terms of the blood volume, right? Whereas an adult can withstand some amount of blood loss, less 200, 300 ml, or sometimes even 500 ml. It's reasonably safe. You can go ahead and operate with the very vascular tumors. Whereas children, we can never do that because their whole blood volume is so small. So you have a very, very big challenge about loss of blood during surgery. So you have to be extremely careful when you operate on these small kids that you don't lose extra blood. You have to be very, very meticulous, very careful when you operate, and they don't tolerate very long duration of anesthesia. So all these multiple things, when we do the surgeries on the children's brain, we have to be very careful and treat them. And if it's a growing skull, you have to make sure that you don't use implants which will prevent the growth of the skull or which will harm the child in any way. So all these multiple things we take into considerations when we operate on pediatric patients, and that's a very unique and interesting challenge. And we have very, very well-established protocols to do all this right now.
Yeah, I mean, it's a very difficult decision. I mean, it's more spontaneous. You have to decide at that time, like what will work for this children versus the other. I mean, 1 month is like too young to handle even, right? I mean, it's a very difficult to.
So sometimes we even stage it. So we know that this is a benign condition and the child won't get worse. So we kind of wait for the child to reach a particular age before we do the surgery.
True. Yeah. Right. I think at least they have the physical ability to handle such challenges. Yeah. Any specific moment which you want to share, which deeply moved from working with children and the conditions improved? So any examples you want to talk about?
Correct. So this was during my training when I was finally a senior resident. Okay, we had a very young child which had come from interior Maharashtra, and obviously at that time we didn't have so much of technological advancement or the reach of these advanced kind of surgical things into these interior towns, which may be true in some parts of North India even now. But this child's parents were extremely distraught. They thought that is the end of the life. You know, this was their very precious child after a long time of trying after marriage. And this child had a huge posterior fossa tumor, which I was just telling you, which is in the back of the brain or the cerebellum. And we know that this was a benign tumor. But the pressure that it had caused on the rest of the structures around it had led to severe swelling in the head. Child had become very dull, not eating, vomiting anything that it takes. His vision had dropped and all that. And they just came to us and said that, please, doctor, this is the final thing you are in. Now we are in Mumbai. We can't go anywhere else. Please do something. And we went ahead and did the surgery. I was the main person involved. So we went ahead and did the surgery. And luckily, we were able to remove the complete tumor. And we were able to drain the fluid out, which was accumulating in the brain also. And like I told you, it turned out to be a benign tumor. And the child did dramatically well. You know, it started walking, it started moving, became as active as it was before. And you can see the tears of joy in the family. And to them, it was like we were like gods. You know, we know that it's not true. probably some other neurosurgeon, if they had gone, they would have done it. But it gives you an immense satisfaction
Mm.
to see that this child is going to have a normal life, because we know these tumors don't come back, and they just have to monitor regularly, and it doesn't affect their cognition to any extent. So it can go back to school, do all the activities. So that was a very, very touching and life-changing moment during my final year of training, which still I owed very dearly. And my professors always used to tell us, you are not God, so please don't get into this, ego trap, which is, that you are doing something that like God. So it's like, what is your duty? You have been doing, what is their purpose in doing all this is to make somebody else's life better. And actually, you're lucky to be in that position to be able to help. So that's how we have been taught, and that's kind of strongly, in our mind, that please think the other way, that you are lucky that you have got a patient who has come to you for treatment. So it's like that. So that way, that was a real life-changing moment. And I still remember my professor's words. Please, you saw a good result. Be happy on that day, thankful to God, and, move forward.
True. You're very humble, right? I think, but I think from a patient standpoint, it's a life-changing event, and especially when it comes to children, it's really difficult times, and both for children and the family. And anything which improves their ability to function or do things as a normal child, it's very important.
Exactly.
It's very welcoming to see, and those are stressful times, right? I think I know today when you talk about brain, the amount of usage of stress is like a very very abusive term, right? Everybody thinks, but I think what you do and what surgeons do to revive the lives, and with all these decisions you're making on the surgery OR, those are stressful times, both for patients as well as the surgeons. I think
some of these surgeries go on for 10 hours, 11 hours.
Wow.
So you have to be, it's kind of part of your neurosurgical training. And like you said, we are constantly planning in our mind, right? So even the day before surgery, we are constantly thinking what I will be doing, what this can happen. But in spite of all that, as you encounter the tumor or as you encounter things during surgery, it can always change. It's a very dynamic thing. It's not like, any other thing. It depends on each individual.
It's not a pre-planned. Anything can go at the time.
So that way, that amount of stress is there. But obviously, over a period of time, you have been doing these things regularly, and then you get an idea as to how to manage each patient as it comes.
This is just a glimpse of one of the many conversations we've had on this channel. If you found this thought-provoking, please don't forget to subscribe and explore more insights from unfiltered voices and the real-world experts. And please don't forget to like and share this video to as many people as possible. It keeps us going. See you in the next one.